A muscle strain can hit you like a lightning strike. So let's look at the right way to recover from it. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I will talk you through the rehabilitation process for a muscle strain. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Muscle strains, also known as a pulled muscle, are quite common, especially if you're very active or returning to a form of exercise, or if you play a sport that places a lot of stress on the muscles. These are normally triggered by a lack of an appropriate warm-up, a sudden exertion or stretch of the muscle, a prolonged period of overloading the muscle beyond its limits, or it can be a result of a mechanical imbalance that gradually builds up a weakness in the muscle over time until it causes a rupture. If you've experienced this type of injury, then you would have felt a sudden pain or popping feeling in the muscle or tendon that leaves swelling, bruising or redness and makes it difficult to use the muscle following the event. It can also limit your range of movement, so will stiffen up quite quickly. The most common sites for this type of injury are the calves, the hamstrings, the quads, the groin, the lower back muscles and the triceps. Muscle strains are generally categorised into three types. Grade 1 is an overstretched muscle, causing a mild tear of less than 5% of the muscle fibres and feels like a light twinge at the time of injury, but probably won't affect movement that much. Grade 2 is a moderate tear that causes a lot more pain, even at rest, and will affect strength and movement and will take longer to heal and rehabilitate. Grade 3 is an 85% muscle fibre tear, all the way up to a complete rupture of the muscle. This type of muscle strain will require emergency medical treatment and possibly surgery, so won't necessarily be applicable to the advice given in this video. There are three stages to recovering from a Grade 1 or Grade 2 muscle strain, so let's look at each stage in more detail. The first stage, known as the acute phase, is the immediate first aid for a muscle strain. It also applies to the first 2 to 5 days following the time of the injury, depending on the site and severity of the muscle strain. This is when you apply the principle known as PRICE. P stands for protection. This is where you ensure you remove any likelihood of further injury or complications by removing tight clothing, jewellery, and taking care not to move or put weight through the affected muscle. R stands for rest. This is ensuring that you stop the activity you're doing and that no stress is placed on the muscle to allow the healing process to be more effective. This doesn't necessarily mean avoiding movement altogether, because this might not be realistic, but certainly don't stretch the muscle or move it against a resistance. I stands for ice. Applying an ice pack or frozen peas wrapped in a tea towel straight onto the affected muscle can help reduce swelling, and this should be performed for 10 to 20 minutes 3 to 4 times a day, certainly in the first couple of days after the time of the injury. C stands for compression. If you can place an elasticated bandage around the injured muscle, then this will also help keep swelling to a minimum. Just be careful not to have the bandage too tight. Finally, E stands for elevation. Where and whenever possible, keep the injured muscle elevated above the level of the heart. This will allow gravity to drain fluid away from the site of the injury. The second stage, known as the subacute phase, is aimed at mobilising the muscle again and would take place at least 5 days after the time of the injury or when the pain has subsided, and it will last for up to about 21 days or 3 weeks after the point of injury, again depending on the site and severity of the injured muscle. The purpose of this phase is to increase the blood flow and circulation to the affected area to further promote the healing process to the damaged tissue. Methods used in this stage include heat or thermotherapy, where the muscle is warmed up from an external source for about 30 minutes or more to improve blood flow to the area. Light massage of the muscle tissue can be useful to reduce the buildup of tension and help prevent the scar tissue adversely binding adjacent muscle fibres, causing a muscle knot. Gentle, active stretching can also be beneficial, where you contract the opposing muscle to stretch the injured muscle, like for example pulling your foot and toes back to actively stretch the calf muscle. Don't do any deep relaxed stretching at this stage, as it can be counterproductive. And I've done a video on active stretching, and I'll leave a link in the description below so you can check that out after this video. It's also worth trying to return to normal functional movement to allow the muscle to start moving again. So this can include activities like walking, gentle cycling and swimming. It's important to note that this phase must not be initiated too early, otherwise further damage can be caused to the muscle. In addition, it's also important not to stress the muscle directly or load the muscle too much. So while light resisted movements and general conditioning exercises will be okay to mobilize the muscle, don't be too keen to get back into the gym, go out for a run or start playing your sport. It's important to listen to the body, be pain-free with your movements and stay conservative with your approach towards the final stage. The final stage is known as the late phase, and its focus is primarily to get you back to doing your sport, exercise routine or even activities of daily living. This phase will start from week 3 and continue up to anywhere between week 6 and week 12 depending on the severity of the injury and what it is you'll be going back to. Some elite athletes may even be at the stage for many months after the injury. There are different methods you can use in this final stage, but the goal is to strengthen the muscle and tendon to get back to at least 90% of the strength when comparing it with the non-injured side, and also to obtain a pain-free full range of movement. This is normally the stage that most people get really anxious about, as they are being asked to load their muscle again, which they may not have done since their point of injury. So, isometric exercises are a good start point, where the muscle is being contracted but not moving. An example for the quadriceps is a wall sit, so to activate the muscles but in a static position until you begin to feel the onset of muscle fatigue in the affected leg. You can then progress to eccentric strength exercises. This is where the muscle is being lengthened under a load or a resistance. An example for the hamstrings is slowly straightening the knee while under some tension against a resistance, controlling the movement. Then you can progress to typical strength exercises that you might see in a gym environment. An example for the triceps is an elbow extension movement using a suspension trainer, where the muscle is continuously under load throughout its full range of movement. Or for the calf muscle, flexing the ankle using a step and lowering and lifting your body weight through its full range of movement. For those returning to sports activities where specific movement patterns will be performed, further methods of rehab exercises can be carried out after your general strength training. These can include more dynamic-based movements such as agility exercises, proprioception training, and even plyometric type exercises. As you recover, the load and the speed of the movement can gradually increase. You should aim to perform your chosen strength exercises on 3 sessions a week with at least 1 day's rest between each session. And for your specific injury, I would advise speaking with a suitably qualified personal trainer, strength and conditioning coach, or a sports or physiotherapist to give you an individualised programme of strength exercises for you to follow. During this final stage, you can also continue the methods mentioned in stage 2, as well as other forms of therapy such as deeper relaxed stretching, foam rolling and deeper tissue massage, working alongside the strength training component to get your confidence back to a point where you feel physically ready to return to your main activity. I hope this video has helped you today. If so, please give it a like by clicking the thumbs up button below and share it with others to help this channel grow so more people can benefit from these videos. And remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.